In 1977, after a big plane crash in the Canary Islands, the airline industry decided to work together to reduce their error rate. Those tools were used based on the Toyota automotive processes called Lean Six Sigma that were developed in Japan. Now we have the safest route of transportation in the airline industry. And so the goal is to have the safest form of healthcare in the hospital industry utilizing the same tools.
Our biggest opportunity in healthcare is doing things better and doing them at a lower cost. And that's what some of these tools of Lean and Six Sigma bring. Working on key focus areas such as reducing readmissions, preventing falls, preventing infections, and making a difference in patients' lives.
We have over the last 3 years trained probably 150 plus people in hospitals across this state that have used those tools to improve the care for the patients in their communities.
The project we decided to work on at St. James is sepsis, and sepsis is a very serious disease. It's an infection in your bloodstream, and once it gets into your bloodstream, it can very rapidly advance to having very fatal effects on a patient. So it's very important that we identify it quickly. By having a reliable tool and a process that we're able to use very consistently in the emergency room, we're identifying those patients that much quicker. And by identifying them quicker, we're able to give them the right medication and the proper protocols in place to prevent that sepsis from getting worse and ultimately saving lives.
Here's the bottom line. This stuff works. That's what I heard resonating throughout the day today as hospitals came together and shared improvement stories of preventing patients from coming back to the hospital, of saving people's lives by recognizing that an infection was occurring, before it got too late. This stuff works, and it's saving people's lives across the state.